Hi, welcome back to my channel. In this video, I'll be talking about epidermolysis bullosa. So basically, I'll be referring to all the important points that are needed for you to know for the entrance exam. So first of all, we need to know that there are around three types of epidermolysis bullosa. So we'll understand them through headings. So first one is epidermolysis bullosa simplex. All right. Then we have epidermolysis bullosa junctional, and then we have give me a second, then we have epidermolysis bullosa dystrophic. Now this dystrophic is further into two. One is dominant and one is recessive. Alright, so let's start with the epidermolysis bullosa simplex. So first of all, you should know that in epidermolysis bullosa simplex, you have a mutation in keratin 5 and 14. Alright, in junctional, there is the LAM3 gene mutation. Alright, and in epidermolysis bullosa dystrophic, you have a COL7A1 gene mutation. Now over here we have intradermal skin separation. In epidermolysis bullosa junctional, we have skin separation between in lamina lucida. Alright, and here we have sublamina densa basement membrane zone separation. Alright, now let's talk about the features of each. Now for features, you should know that the epidermolysis bullosa simplex is autosomal dominant. Alright, and the blisters heal without scarring. It improves with puberty. Now next important is that its localized form is called as Weber-Cockayne syndrome. Alright, then oral manifestations are rare. Alright, then coming on to junctional. Now in junctional, you need to have three criterias to be fulfilled to consider it as epidermolysis bullosa junctional. First, it should be the onset should be at birth. Then second, there should be absence of scarring, milia or pigmentation, and third is death within 3 months. Now it has oral manifestations like bullae and upper respiratory tract infection, esophageal. It also shows enamel and dentine developmental disorders. Okay, now let's talk about this epidermolysis bullosa dystrophy. Now dominant form occurs at dominant EBD and EBDR recessive. Dominant form can occur at infancy, also at puberty. Recessive form is present at birth. Okay, then here you have blisters and you have keloidal scarring. There are nails are thick and dystrophic. Eyes are never involved. Alright, and then you have few more things like you can have palmo plantar keratoderma, hyperhidrosis, or even trichosis. And there is absence of elastic and oxytalin fibers. Okay, now let's talk about the recessive form. So as you know, it has to occur at birth, then it is due to spontaneous, or basically it is spontaneous, or basically it is because of in trauma, so trauma induced. So it heals with scarring. Here you have club like fists, nails absent, hairs absent. Now in oral manifestations, this shows a number of oral manifestations. So most common is presentation is bullae. Now bullae occur at tongue, larynx and pharynx. So this leads to basically dysphagia and hoarseness of voice. Then strictures in esophagus, then hypoplastic teeth, and there will be pre-elastic and oxytalin fragmented fibers. So this basically completes everything that you need to know about epidermolysis bullosa. Question is mainly asked on the mutation and the separation and some features that you should know. Okay, so if you found this video helpful, do give it a share, subscribe, and thanks for